Hi, I'm Dr. David Hill, and today we're going to be talking about how to relieve a sinus pressure headache. The first thing to know is, do you have a sinus pressure headache? Those are usually located either here or here, sometimes on both sides. This is where your maxillary sinuses are. Or sometimes they're located up here, again often on one side where your frontal sinuses are. Now there are also ethmoid and sphenoid sinuses that are deeper in the head, but they're less likely to cause a headache. Another thing is to think about your age. Children, especially children under age 10, almost never get sinus pain as a sign of sinusitis. So if a child of that age is complaining of a headache, it's very unlikely that it's due to the child's sinuses. That probably needs to be brought to a doctor's attention so the doctor can figure out what really is causing the headache. But if you have classic sinus pressure and also symptoms of a sinus infection such as runny nose, stuffy nose, cough, sore throat, or fever, chances are good you're right about the cause. Then what can you do? Well, there's a couple of things. For example, there's over-the-counter decongestants, such as Afrin. This is probably the most effective way to decongest the nose compared to using an oral decongestant like phenylephrine or pseudoephedrine, and probably also the safest. But you only want to use those nose sprays for 2 or 3 days at most. Using them for longer periods can cause rebound congestion when you stop. So put a little mark on your calendar and make sure you stop after 2 or 3 days. You can also use an ancient relief called a Neti Pot. This looks kind of like a wizard's or a genie's lantern, rather, or a teapot. It's designed to introduce some salt water into the nose. Now, where are you going to get salt water? You don't have to move to the ocean if you don't live there already. You can actually make normal saline solution with 1 cup of water and a half a teaspoon of salt. You might do well to boil that and let it come to room temperature so that you know it's relatively clean and sterile and the salt is fully dissolved. Then you can introduce that into each side of the nostril or each side of the nose using the Neti Pot. That's been shown to relieve sinusitis. Now, for people who have a sinus infection, the doctor can also prescribe nasal corticosteroids such as fluticasone or mometasone, Flonase, or Nasonex, for example. And that will cut down inflammation inside the nose, cut down the swelling, and allow the sinuses to drain. Lastly, if you're having these symptoms, your doctor may want to prescribe an antibiotic. Now, the medical literature has not shown that antibiotics make nearly as much difference as we would like them to in treating acute sinus infections, but it's another modality your doctor may choose to use. So, talking about how to relieve sinus headache congestion, I am Dr. David Hill.